For people who are dealing with knee and hip issues, this is one of my favorite exercises. And it's actually great for people who like to walk for recreation and for runners. So they're called step throughs. And it's very simple. This is what we're going to do is we're going to plant one leg down on the ground and you're going to maintain that position, that stable leg. With your opposite leg, the moving leg, you're just going to simply step through the other leg. Just step back and forth, nice, slow, and controlled. Now, what we're doing with this exercise is we're making sure that this knee stays in line with the ankle and the hip. So keep the knee pointing directly at the camera. And actually, if you could do this exercise in front of a mirror, that's the best, so you can really see if that knee starts to bend in. That's what we're looking for here. If the knee does start to collapse inward and you start to lose your arch as well, that suggests that there might be some weakness here in the hip complex on the lateral rotators, external rotators of the hip, gluteus medius, gluteus maximus. So those muscles are required to maintain that alignment as your body moves through different positions. So if it starts to roll in, we might want to take a look at the strength of these muscles here and start to strengthen them to fix that alignment issue. So as you're stepping back and forth through, try it for 30 seconds, see how it feels. Depending on what your demands are for your body, if you're a long distance runner, you're going to want to be able to do this comfortably for minutes at a time, 2 minutes or so, and see how that feels. Now, as you do this, you're probably going to feel in the quad a little bit, but I want you to try to focus your attention on contracting this muscle here. Try to feel the outside of the hip, feel those muscles working. Okay, so once you feel comfortable doing this and you're able to do it for minutes at a time without a lot of fatigue, and certainly don't work through any pain with this, now you have to remember that the body works in 3 dimensions, right? Not just all forward and backward. So let's make sure we're training the tissues to accommodate for those challenges. So now we're going to set up the leg the same way, and now we're going to step across the body. So we're going to step in front and also try it in back. All right, again, we're just making sure to maintain this alignment between the hip, the knee, and the ankle as you step through. All right, finally, the last one is rotation. And this one might be the most challenging because you probably don't work your rotational components throughout most of your day. So we're gonna start in front of the body, rotate around, touch, back and forth, and just go ahead and do that. Again, making sure this knee is not collapsing inward as you change your position with the moving leg. All right, so those are step throughs. Give it a shot. Obviously, you want to do both sides and really see if one side feels a little less stable than the other, and then we might want to look and address the problems on that less stable side. So if you have any questions, don't be afraid to message me. I'm here to help you.